Welcome to the deep dive. Today, we're tackling something really critical in global health. It's this worrying trend, this resurgence of diseases we thought vaccines had mostly beaten.
It's definitely concerning,
Right.
despite vaccines being such a proven success story.
Exactly. We're seeing things like measles pop up again, illnesses we kind of felt were in the past. It's a vital topic for anyone trying to grasp current global health challenges, and particularly relevant if you're following developments for the UPSC exams.
It really is a stark reminder, I think, that public health progress isn't, automatically sustained.
Yeah.
Even with clear-proof vaccines work, various factors are creating the situation now.
Right. So for this deep dive, we're looking at recent reports from the Hindu and also the World Health Organization, the WHO. We want to really dig into what they're saying, understand why this is happening, what the impact is, and what can actually be done about it, both globally and closer to home in India.
hmm The goal isn't just to state the problem, is it? It's to analyze the roots of the trend. Look at how vaccination efforts are getting disrupted, the consequences for kids missing vaccines, and, well, explore the solutions these big organizations are suggesting.
And just to show how real this is, think about this statistic. The U.S. declared measles eliminated way back in 2000. But as of May 1st, 2025, a shocking 935 cases. That's like more than triple the entire number for 2024.
Wow.
Yeah. So this isn't just an issue for, say, low-income nations. It's truly a global thing. Okay, so let's get into the core of it. What are the main reasons the Hindu and WHO are pointing to for this resurgence?
Well, they highlight a few key interconnected things. Maybe the biggest is funding. Significant cuts to funding for essential immunization programs around the world.
Funding cuts. Okay, that makes sense. It directly hits the ability to run campaigns, get supplies.
Exactly. It has a very direct, very tangible impact on the ground. And then layered on top of that, you have the disruption to immunization efforts themselves. Things like the recent pandemic.
Yeah.
They created huge backlogs in routine jabs, meaning lots of kids just missed out on vital doses.
Right. So less money and logistical headaches getting the vaccines to people. A double whammy, really.
Pretty much.
Yeah.
And WHO, UNICEF, Gavi, the Vaccine Alliance, they also stress the ongoing problem of misinformation about vaccines.
Oh, yes. That hasn't gone away.
No, it really hasn't. And it chips away at public trust, which, naturally leads to fewer people getting vaccinated. Plus, you've got pressures like population growth straining health systems and humanitarian crises. Those often leave very vulnerable people with almost no access to basic health care, let alone vaccines.
That's a really concerning mix of factors all pushing in the wrong direction. And we're seeing the impact in the data, aren't we?
We are. WHO did this rapid review looking at 108 low and lower middle income countries. And the findings, they're pretty stark. Nearly half, almost 50% are facing moderate to severe disruptions.
Disruptions in what exactly?
In their vaccination campaigns, their ability to actually get vaccines and supplies out to where they're needed most. Donor funding reductions are a big driver there.
Nearly half those countries. That's a huge proportion. Having trouble with such a fundamental thing. So what does that mean for the actual numbers? How many kids are missing out?
Yeah, that's where it gets really worrying. It translates directly into more kids missing their routine shots. In 2023, the number was 14.5 million children globally. These are kids who didn't get any routine vaccines. Zero-dose children.
14.5 million.
And that number is up. It was 13.9 million the year before in 2022 and 12.9 million back in 2019.
So even before the pandemic hit hard, the trend wasn't great.
Exactly. We were already losing ground.
And these aren't just numbers, are they? Each one is a child at risk of, really serious diseases, preventable ones.
Absolutely. And the data shows something else, too, a real disparity. Over half of these unvaccinated kids live in fragile or conflict-affected regions.
So the places where it's already hardest to deliver healthcare.
Precisely. Instability, people being displaced, damaged infrastructure.
Yeah.
It makes an already tough job almost impossible sometimes.
It's that awful cycle, isn't it? Conflict weakens health systems, more kids miss vaccines, you get outbreaks, which can make the instability even worse.
A very dangerous cycle, yes. And there's another layer to this. Sources also say over half the countries they surveyed reported big disruptions to their disease surveillance systems.
Surveillance, you mean tracking outbreaks?
Exactly. Spotting diseases early, seeing where they're spreading. It's like fundamental to public health response.
Yeah.
If that's weakened, you can't detect outbreaks quickly, you can't control them effectively. The risk of unchecked spread just goes way up.
Okay, so fewer kids getting vaccinated and we're less able to see and stop outbreaks when they happen. That's not good. Let's switch gears slightly. WHO talks a lot about the value of vaccines, the return on investment. Can you expand on that?
Sure, WHO is really clear on this. They call immunization one of the best buys in public health. Super cost effective. Their analysis suggests for every $1 spent on vaccination programs, you get about $54 back.
$54 back for every $1 spent. How does that work?
Well, it includes things like savings on treating illnesses, obviously, but also gains in productivity. Healthy people work and contribute more, and just broader benefits to society, well-being.
That's a pretty compelling economic case. Makes you wonder why the funding cuts are happening despite that evidence.
It's a key question. And the sources touch on, shifting global health priorities, other crises demanding attention, political factors. It's complex, but the long-term value of investing in prevention like this, undeniable. And beyond the money, the human impact is just huge. Over the last 50 years, vaccines are estimated to have saved at least 154 million lives.
154 million.
Globally, which works out to about 6 lives saved every single minute.
6 lives a minute. Wow. That really puts it in perspective. And I think I read the measles vaccine was a big part of that.
A huge part. Yeah, the measles vaccine alone accounts for something like 60% of those 154 million lives saved.
Incredible.
It really shows how effective that specific vaccine is, but also how deadly measles itself can be if it's not controlled.
And vaccines do more than just stop people getting sick from one specific disease, right? They've had a wider impact.
Oh, absolutely. A massive impact on overall health stats. Infant mortality, for example. Vaccination has been a major factor in reducing the number of babies dying worldwide. It's contributed to about 40% of the improvement in infant survival globally.
40%. So many more children surviving that critical first year.
Exactly. More kids reaching their first birthday than ever before in history, and vaccines are a cornerstone of that achievement.
It's easy to forget these massive successes sometimes, like smallpox. Completely gone.
Eradicated. A historic public health triumph. Entirely down to global vaccination efforts.
And polio, we're so close with polio, too.
So close. Again, demonstrating what's possible with concerted effort and science. And even now, day to day, vaccines prevent nearly 4.2 million deaths every year, just from 14 major diseases. It's ongoing vital work.
And part of how they work so well is this idea of herd immunity. Could you quickly explain that?
Sure. Herd immunity, or sometimes called community immunity, it's basically when enough people in a population are immune to a disease, usually through vaccination, sometimes through having had the disease. If enough people are immune, the disease can't spread easily. It hits dead ends.
Okay.
So this protects the whole community, especially those who can't be vaccinated, like tiny babies or people with weakened immune systems.
Right. So getting your shot isn't just protecting yourself, it's protecting others, too. Especially the most vulnerable ones.
Exactly. It's a community effort.
Okay, let's bring this to India now. The Hindu report highlighted some real progress there, didn't it?
Yes, definitely. India's made some really commendable strides. They achieved polio-free status back in 2014, which was huge, and eliminated maternal and neonatal tetanus in 2015.
Big milestones.
Absolutely. Shows what sustained, focused immunization strategies can do, and, the hard work of health workers on the ground.
And India's also added more vaccines to its national program over the years?
That's right. The Universal Immunization Program, or UIP, has brought in important new ones. Things like the combined measles-rubella vaccine, the pneumococcal conjugate vaccine PCV, which fights pneumonia, and the rotavirus vaccine for severe childhood diarrhea.
So broadening the protection offered.
Yes, showing a commitment to tackling a wider range of preventable diseases.
The scale of that UIP program in India, it's just enormous, isn't it?
It really is. It's a massive operation. They aim to reach about 26 million newborns and 34 million pregnant women every single year.
Wow. How many sessions does that take?
Over 13 million immunization sessions annually across a huge, diverse country. It's quite an achievement in terms of logistics and infrastructure.
Despite that incredible scale, there are still gaps, right? The data shows not everyone is getting fully covered.
Unfortunately, yes. That's the challenge that remains. The latest National Family Health Survey data, NFHS5 from 2019-21, showed that about 23.9% of children in India are still missing out on their full schedule of routine immunizations.
Nearly a quarter. That's still a significant number.
It is. It highlights that there are still hurdles to overcome in reaching every child, regardless of where they live or their family situation.
So big progress, but still a way to go to ensure every child is protected. Which brings us to, well, what next? What's the way forward globally and for India? What are WHO, UNICEF, Gavi saying needs to happen?
The main message, really, is a call for reinforced support from everyone: parents, communities, the public, and especially political leaders and governments. They're stressing the need for sustained and ideally increased investment in vaccine programs.
More money consistently.
Yes, and sticking to the goals of the Immunization Agenda 2030, really recommitting to that global plan.
And there's a big funding event coming up soon, isn't there? The Gavi Summit.
That's right, the Gavi Pledging Summit in June 2025. It's a really crucial opportunity. They're aiming to raise at least $9 billion.
$9 billion. That sounds like a lot.
It is, but the goal is huge too. Those funds would help Gavi protect an estimated 500 million children between 2026 and 2030, and potentially save over 8 million lives in that period. So the success of that summit is, well, pretty critical for tackling those funding gaps and getting vaccines out there.
Okay, so the bottom line seems pretty clear. This resurgence of vaccine-preventable diseases, it's a serious global threat. It needs urgent attention, sustained effort, and a significant investment to turn things around. And for those of you listening, especially preparing for UPSC, this is definitely a key issue. It cuts across public health, international relations, development, relevant for mains, maybe even prelims questions could pop up.
Absolutely. And it's important, I think, for everyone, especially future administrators and policymakers, to really grasp how interconnected global health is. Problems in one place, like immunization gaps, they really can ripple outwards and affect other countries, even wealthy ones. We saw that with the U.S. measles example.
Right. Which leads to a big question for you to think about. We know vaccines work. The science is overwhelming. So, given that, what do you think are the best ways, effective, ethical ways to fight back against misinformation? And how do we ensure everyone, every child, everywhere actually gets access to these vaccines?
It's a tough one. No easy answers there.
Definitely not. But thinking through potential strategies is really important. We really hope you'll engage with that. If you found this deep dive helpful, please do like and subscribe for more discussions on key global topics. And drop a comment below. Let us know any further questions you have or share your own thoughts on this issue.
And if you want to go deeper, definitely check out the original reports we based this on from the Hindu and the World Health Organization.
Thanks so much for joining us for this deep dive.